and for some of our older elementary kids, it might be decisions such as, hey, you were running around outside. Do you want to take a shower or a bath tonight?
And then maybe the next time you say, I'm going to stand back while I watch you pack your lunch. And then maybe the next time they do it on their own.
Welcome back to another episode of the Unspoken Words Podcast, a Selective Mutism podcast by the Smart Center, produced and published by New Edition Productions. This episode features a discussion between Dr. E and Dr. Jenna Blum, a lead clinician at the Smart Center and the head of the Smart Center's growing mental health department, counseling and assessments. Dr. Jenna has experience working with children, teens, and adults with a wide array of acute and chronic mental illnesses such as anxiety, depression, substance abuse, autism, learning challenges, and of course, selective mutism. If you've been to the Smart Center's Community Camp, you'll recognize Dr. Jenna's voice. She is the supervisor and director of Community Camp counselors. In this episode, Dr. E and Dr. Jenna discuss how to encourage decision-making, the importance of fostering self-help skills, developing your child's problem-solving skills, and more. Before we get started, if you have any questions on anything you hear in today's episode, please head to selectivemutismcenter.org/ask-Dr. E, that's ASKDRE, and enter your question in the form. We read all your submissions and we do our best to answer them on podcast episodes, blog posts, and on social media. And speaking of social media, make sure you're following the podcast on Instagram and YouTube. We will be posting the best clips of this episode and every episode of Unspoken Words on both of those platforms. We are at UnspokenWords_podcast on Instagram and Unspoken Words Podcast by Dr. E on YouTube. All right, without further ado, please enjoy the latest episode of the Unspoken Words Podcast.
Hi everyone, it's Dr. E. Before we get started with today's episode, I'm so excited to announce that our popular Selective Mutism in the School virtual conference is now available as a self-paced online course. The conference dives into how to assess the mute child, testing for common comorbidities, and proven strategies and interventions to support students with SM within the school. And of course, we dive into accommodations and interventions such as 504s and IEPs. The course offers 5.5 continuing education credits for most professionals. So parents, share this opportunity with your child's school. To sign up, just head to our website or check the description in this podcast episode. Together, we can create a world where every child has a voice. Now, enjoy the episode. Good afternoon, Dr. Jenna.
Hi.
How are you today?
I'm good. How are you doing?
It's great seeing you in the office over there. It looks great.
Thanks.
Yeah, so today I'm excited because, one, as my listeners know, I'm always excited to do a podcast. It's a way to share my knowledge and get people thinking and offer them tips and strategies to help their child become a confident, social, verbal communicator, right?
Exactly.
That's our goal. So often we get at the Smart Center when families call us, I need my child to talk. I want my child to talk in school. What can I do to help them talk? Talk. And although we know the ultimate goal is a confident social verbal communicator, there's a lot about that child that we need to understand and support families with and build that child up to be able to have the skills to be a confident social verbal communicator, one that can connect socially, feel comfortable, know what to say, how to say it, and not be so anxious. Agree?
Definitely, yes.
So I thought I'd start with a quote. When children feel capable, they feel confident. And confidence is the cornerstone of communication, self-expression, and emotional growth. So guess who said that, Dr. Jenna?
I feel like it was you.
It was me! It was me. I said that because I feel that when we work with families, with children, with teens, even with adults, one of the challenges is they're not confident. They're overly dependent on others. And as a result, it's almost like the car stops. It can't move forward because they need that confidence to move forward. And one of the hallmarks of confidence is independence. To be able to be independent emotionally, to be independent communicatively, to be independent socially, to be an independent person so that will foster their confidence, which leads to fuel for communication progression. So I thought that quote was important because of that philosophy, I need my kid to talk philosophy. If you have a child that is overly dependent and not independent and really struggles with that sense of self, it's going to be tough, right? So tell us, I mean, you see this at the office all the time.
Yeah. I think that, a big component that we're also finding is for some of our little ones. I know we were talking about maybe having two parts. Like today, we're going to be focusing more on elementary school and younger children. But we also see this even with our teens and young adults. But when we think about like our elementary school kids, it's so hard to foster sometimes like that independence when for so much of their life, especially for like, think about like our 5-year-olds, 2.5 years out of their 5 years, they were so dependent on their parents because of COVID. So it's an interesting dynamic now that we're seeing where that's a whole other topic. But I do think that I'm noticing a big shift of dependency, but also because of the fact that that was such a huge piece for them that they didn't have a lot of that exposure to maybe some of the other individuals. So then their independence is even more kind of, I guess, taken away because they're so dependent on the one or two people that have kind of developed everything for them. So I definitely think that's been a huge piece is just building, like you said, that confidence because before we can even, build any type of independence, we need to have our head up. We need to trust that we can take that next step. And I think that's a really important key that, like you said, so many people assume that the first step is just giving them an opportunity. Oh, pass that to the waiter. But if they're not even able to feel that confidence and kind of put their head up and know that they can do it, they're not going to be able to feel successful.
And they'll be more avoidant and anxiety is reinforced. So it really is about meeting them where they're at. Also, think about it, communication. That is such a critical part of life. And so our kids don't just struggle with words, many of them struggle non-verbally. They struggle to engage socially. They struggle with going to a friend's house. They
Right.
struggle with being able to do things on their own, to be able to go to a party without their parent, to be dependent on a sibling. And so
Hmm.
we see a lot of this, and
Yeah.
communication is such the hallmark of life. And
Hmm.
therefore, it's so easy for a child or a teen to be dependent because, as a parent, and I'm a parent, you're not a parent yet that I'm aware of, but as a parent, you don't want your children to struggle and suffer. You want to do whatever you can to help them. And a lot of times, what you do as a parent is you rescue them. You do it for them. You should do this, like you should do that, or do say this or say that. And our children end up being the passenger in the car rather than the driver in the car.
Hmm.
And we have to teach skills, teach parents how to support their children to help them become independent. Because it's not like, well, you need to know what to say to that person, or you need to go to that birthday party because everyone's going to go to that birthday party, or you know what, don't wear that outfit, wear this outfit. And we're very, very directorial because is that a word, directorial?
I think we're just very direct with our
Yeah,
approach.
no, I'm being funny, but we're very much guiding them to help save them in many ways because they either can't do it, and we want to, support them so they don't feel pain and discomfort. But what we're doing is we're literally creating that passenger in the car situation where eventually, even at all, they can't do things on their own well with confidence because they're so dependent on others telling them what to do, how to say it, what to say, but just their everyday life. And so
Yeah.
and this isn't just for SM. I mean, this is just for children in general. And I think you brought up a great point with COVID. I mean, our kids weren't even around people for so long. And when they were, it's be careful, don't get near them. And they had masks. So reading facial cues, all of that is definitely an issue. And for certain age ranges, it's even more. You know what else is a challenge is technology. And we're not going to get into it, but the
Yeah.
use and dependence on technology doesn't even foster social engagement. You're
Yeah.
not getting together with peers as much. You're not making as much eye contact because you're too busy on your device. So
Hmm.
we're seeing technology as an aid in many ways, but also a way to hinder and hide behind and become very dependent.
Hmm.
It can
Yeah.
be a step and there's values to it. And we
Mhm.
definitely can do another podcast on the value of technology. But I think it's important that we educate parents during this podcast on some simple ways to really help build that independence. Because we're all about treating the person and understanding who they are rather than this is what you need to do to get them to talk, because it isn't that.
Hmm.
Anyone that can say it's all about talking really doesn't understand this population. It's just not, because how will the children know how to engage, what to say, where to say it, how to start a conversation, initiate, expand, if they're not confident? And so
Right.
we have to help kind of meet them where they're at and build them up where they're at to be able to move forward to become a more confident social communicator, and taking into account their whys, because some
Hmm.
children aren't going to be as verbally expressive and initiative as others and may have other challenges getting in the way, and there are many, so we can help them reach their capacity. So you ready, Dr. Jenna, to dive into some 6 great ways to help foster independence for elementary age children, knowing we're going to have an episode on teens?
Yes,
You
definitely.
ready?
Yeah, let's do it.
What's the first one we want to talk about?
So I think the first one that we both kind of thought was really important is this idea of encouraging decision making. And I know that actually, I believe we talked about this a little bit in our parenting podcast that we talked about, because I know that just in general, offering decision making is so crucial for a child. But I do believe that this is such an important key to foster independence, because many times, like we've been mentioning, our kids feel lost. They don't know where to turn. They don't know the next step. And many times we even find that anytime you ask them a question outside of their comfort, no matter what, they turn to their mom or dad, right? And some of you listeners are probably relating to that, not because the child can't do it, but because they're so dependent on you, and for so long you're really the only person, or maybe one of the only people, that they feel really comfortable with. So actually encouraging decision making and allowing them to see that they can do it, right? And kind of providing them with options whenever possible could actually allow them to make decisions, and could allow them to build more of that independence, of course within boundaries that you set. So allowing them to kind of have some of that. But we do find that choices are really important, and for those that work with us, they know that we say that a lot, is provide a choice, provide a choice. Not because we don't believe that our kids can't come to that conclusion, but a lot of times it actually allows them to build up that confidence that they can make their own decision, and that's on them.
So that's a great place to start. And I think we need to give some examples of ways parents can offer choices. How many listeners are listening where when you ask your child a question that they need to make a decision, they go, I don't know. I don't know. I don't know.
Hmm.
I don't know is probably one of the most common statements this population of kids makes to their family. I don't know. Is it that they don't know, or they didn't have many opportunities or enough opportunities to think through a decision? So they almost stop in that pathway. I don't know. It's like, I need you to help me make that decision. I
Hmm.
need you to make that decision for me. I don't have the confidence. I don't have the experience. I don't have the know how, or
Hmm.
not enough to be able to do it. So we have to help them. So we can start as simple as dinner time. Do you want carrots or, beans? Knowing they may like both, which do you want right now? Or do you want both? Something so simple. You have to think through, do I want carrots? Do I want beans? So these are simple ways to kind of get started. Can you give some other examples?
So yeah, so one example could be that, let's say you have a birthday party at the end of the school year and you're super excited, but parents recognize that each time we go to our birthday party, we're not as comfortable. And so instead of just allowing that situation to happen, of course, we do set up silent goals, which we've talked about in some other podcasts, where we do set up the world for our child. So, for example, like some of those decisions could already have been done, like we might go a few minutes early, or we might go with a friend just to kind of build up that comfort. But what if we want to give our child more of a decision and we say, I know that when we go, we always feel more comfortable when we bring a stuffy. Would you rather bring your stuffy duck, or do you want to bring your stuffy teddy bear? And so you're kind of giving them that option to think through that. And so they feel that autonomy, they feel that independence. And so when they go into the situation, they can feel more confident. And maybe they feel even excited to go in knowing that their friend Sally is going to see their ducky. And so that could be another way of just fostering more of that independence.
Yeah, and for some of our older elementary kids, it might be decisions such as, hey, you were running around outside. Do you want to take a shower or bath tonight?
Hmm.
Or do you want to do your homework at the dining room or the kitchen table?
Right.
You see what I
Yeah.
mean? Or what
Yeah.
outfit? Like, we're going to a party. Which dress do you want? And
Mm-hmm.
if the child's like, I don't know, and they're getting really frustrated, you think to yourself, well, is it because they really have a difficult time making decisions? Is it like in general, like, is there something else going on? Or is it more they just don't know and they don't maybe care? So you've got to kind of meet them where they're at and kind of think about decisions to help them kind of like have a motivation to make that decision. Do you want the red or the blue?
I think, this kind of goes a little bit into our second one, but which is going to be like fostering self-help skills. But I think that's something to think about too for families that maybe don't always know the types of choices to provide a child is because like Dr. E mentioned, especially those that are maybe older elementary school age, is even coming up with a list with your child. So that way, when you run into a situation like, oh, we have 15 minutes before bed, why don't we look at our list of some of those choices that you said that you really liked? And so we can make sure that we can do that. Rather, let's say, they wrote down 15 minutes of tablet time, 15 minutes of reading their favorite book, 15 minutes of playing with Legos, whatever it might be, but they can actually look at some of those choices and they can come up with it, with you. So that way they feel even more of part of that decision.
So, those are great thoughts. And one of the questions I would say to our listeners is what daily decisions are you making for your child that they could start making for themselves? And the easiest way to do that is think about your day and be conscious of that tomorrow and the next day and realize, hey, there's so many things I'm doing. I'm making a choice on what they're going to eat for breakfast. I'm making a choice of which shoes I'm putting out for them to wear when they could be making that decision, most likely. Who knows? Some kids come up with real interesting outfits. But really kind of navigate that as a parent. What can they help you with? And even decisions on activities they're going to play with a sibling or help out with. Do you want to help, feed the baby, or do you want to kind of read the baby a story today? And make it very natural. It shouldn't be such a contrived thing. Just ask them opinions that will allow them to make a decision. So that's the goal for that question with our families is write down decisions that you make and that you can now begin to have your children make these decisions, even if you look, there's, hey, what do you want to eat? Versus, do you want eggs or do you want cereal this morning? So the decisions of choices is like the easiest thing to do. The what do you want to do? What friend would you like to pick up on the way to the party? Or which stuffy do you want to bring? That open-ended, thought-provoking. And that's just like our communication, right? When we ask choices, it's easier because they hear the answer. It allows them to be able to make those decisions easier. So that's the assignment for question 1. So what was number 2? We have 6 of them. So let's start with number 2.
So number 2 is fostering self-help skills. So this could look like teaching basic tasks. For example, like encouraging your child maybe to dress themselves, packing their school lunch, or their school bag, maybe tidying up their belongings independently. So let's say setting an alarm and saying, okay, you have 15 minutes. Why don't you clean up as much as you can in your bedroom, right? And seeing how they start to navigate that. I think a lot of times, again, we're talking so much about communication and how we're so dependent on our parents, but in many other aspects, we're dependent on our parents for other things too. And for some reason in this population, I think because we're so dependent on our parents from a communication standpoint, a lot of those other needs start to also become, necessary too. I also think just it's age appropriate to depend on our parents. So thinking about those type of aspects and just like Dr. E mentioned, what could be just like 1 or 2 things that we can start to almost pass the baton on to our child. And again, you're still helping them navigate it too, right? Like maybe you're sitting in the room with them at first, or maybe you start by packing, the school lunch with them and you're showing them the different choices. You're asking them, do you want the tuna fish or the turkey, right? And they're starting with encouraging the decision, right? Or the choice. And then maybe the next time you say, I'm going to stand back while I watch you pack your lunch. And then maybe the next time they do it on their own. So it could actually be a gradual shift too, showing them that you are still there, you're still supporting them, but you're also allowing them to now make that decision.
You made some really good points. A lot of times when we're sitting here talking about fostering self-help skills, encouraging decision making, and then of course the other types of ways to foster independence that we're going to talk about, we understand that many of the kids really have a tough time just doing that, right? Like go clean your room or make your lunch or pack your bag for gymnastics or Kumon or whatever it is you're doing, or do your homework and without have constant reminders. We understand that. So you do need to break it up into steps. And one thing I've always said to families is you got to think of like going from the first floor to the second floor. Maybe there's 20 steps, right? You need to take the first 5 or 6 and divide them up into many. And once you get to the sixth step, you can probably run right up. But it's okay to break things up in steps. And that's one of the beauties of the bridge for social communication. We break it down. And even with the transitional to a verbal, we're breaking that down into many different steps. We're making more columns to be able to increase the distance of an intermediary, or to sound shaping them into words, or a mom has to help take over and together, hand over hand versus moving their hand to their elbow. Some kids can just do it. So I think it's really important for our listeners to know is we need to meet them where they're at. I need to repeat that. We meet them where they're at so that they gain that confidence to be able to move forward. When you don't meet them and you're too far ahead expecting them to be there, you actually cause more anxiety and more avoidance. If you are too far behind and do everything for them, then they're just going to feel like incapable, right? Like they're not going to be able to do it. Either way, they're going to feel incapable and not independent. So we have to meet them where they're at and then move. And I would say that, routines such as schedules, getting up in the morning, brushing your teeth, getting dressed, having breakfast, checking it off, maybe the night before we have a checklist, so a daily checklist of like things that they need to do when they do their homework in there.
Mm-hmm.
Maybe they have a checklist of what's included in their bag for gymnastics, right? It's not just my gymnastics outfit. Maybe it's my, shoes. Maybe it's my outfit. Maybe it's a headband. Creating that list that they check off where they help you, not you do it, where they do it through pictures, drawing, writing their list. So packing their backpack, packing their lunch, even making their own sandwiches. These are things that, as subtle as they are, and as much as someone might be oh, come on, just give me some strategies to get my kid to talk. I'm just letting you know that independence is often one of the key factors into more rapid progression into communication or social engagement and communication versus a child that's not. So what are some others?
Yeah.
So we talked about the kind of the lists, the schedules of the day. What other thoughts do you have?
Yeah, no, I mean, I was just going to echo that. I think that that's a really, really big one, especially for our kids when we think about the whys of SM, especially for our kids that might have some learning challenges. There are a lot of comorbidities between ADHD and SM. And so if that is the case, just having like a daily calendar, like Dr. Reese said, where you can have a child check it off, or for a little one, maybe they put a sticker every morning that they take their bath and they brush their teeth. That actually helps with executive functioning. And so it's actually just a really important life skill in general, but then you're still passing the baton and fostering the independence. So all of those things are really, really, really important to just keep in mind. And a lot of times we'll ask parents, let's say for those listeners that do keep a daily calendar, imagine if we took your daily calendar and we said, okay, we're not going to give this to you till the end of the week, and we want you to navigate, and we'll tell you when you have to be somewhere. And we've seen reactions from parents, and they're like, wait a minute, I would lose my mind. I need my daily calendar. I need to know where I'm going to be, when I'm going to be there. And many of our kids feel that too. There's a lot of kids that they need that predictability. They need to see where they're going to be, what that's going to look like. And so all of those are just really helpful keys.
Yeah, no, I love it. And I think for our listeners, because with each question, I want to give them something to think about. What new skill can your child start practicing this week? Even if it takes time and patience to figure that out. Like you really need to think about it. This is also where decision making can come into play, where you kind of talk about, not you need to build independence or be less dependent on me, because that's kind of like uncomfortable, but it's more of, hey, let's have some ways where we're like, kind of, I call it like doing things on my own. Whether maybe you have a 7-year-old and like big girl things, big boy things, things I'm doing, things I'm helping my sibling with, things that they can be in charge of. And so then you may have some like extra bonus ones. So they can be choosing this. Hey listeners, we'll get back to the episode in a second. I want to tell you about Communicamp, our popular 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. Over 3+ action-packed days, your child or teen will engage in immersive activities guided by expert clinicians that build confidence and communication skills in a supportive, fun, and collaborative environment. Spaces are limited and spots book up fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice at Communicamp. Let's get back to the episode. So, a homework assignment for our listeners is to start navigating things that you think your children can start doing on their own and really allowing you to pull back. Why should you, for a 10-year-old, be packing their bag for school? Why? Why not have them do it themselves? Or pack their ballet bag or their Kumon bag, or even packing their lunch and taking their stuff and putting it in the dishwasher. All of those skills, like you said, is building, also helping out at home. So chores.
Yeah, having like chore charts, that's good too.
Very important. It's really, really important. And one way to build confidence with the independence is if your child is older and can help their younger sibling, or if your child is younger but knows how to do a skill better or easier than another child in your family that might be older, maybe they help them out.
Yeah.
So all of those things I think are very helpful.
I think that another way to think about, self-help skills also has to do with problem solving. And that's actually our third one, is promoting problem solving, because not only is it about making decisions or offering them a choice or providing them with opportunities to help pack their lunch bag or clean up their room, but it also comes down to many of our kids have trouble with, any form of communication, whether it's initiating, responding, having more of that self-advocacy aspect, right? And so when we think about promoting problem solving, one thing that comes up is supporting your child and really finding solutions to challenges that they encounter, because many times they might not always feel comfortable putting themselves out there. So it's not that they might not know some of those skills. I mean, some of our kids might need some examples of ways to find solutions, but for some our other kids, it could just be that they know, but they don't always feel comfortable. So for those that maybe don't know, like let's say your child comes home from school and maybe they're in 5th grade and they just had, a fight with one of their friends, or they experienced a challenge. They were in like a small group in their class and they realized that their 2 buddies in their small group were talking about something and they didn't agree with that, right? Is trying to think about, how do we promote that problem solving? How do we help our child figure out a way that they could feel more comfortable rather than us intervening, right? Rather than us just calling the teacher and saying, hey, you need to pair my child now with another peer because that's not working out. What if we help our child navigate and we say, okay, what was it that made us really uncomfortable? What was it that we would like to say if we felt comfortable? And how can we navigate that? And maybe it starts with maybe either you going in with the teacher and your child. And so again, you're kind of playing a part in that. You're still helping them. But it could also just be that, the child starts to recognize what those steps look like. Sometimes it could even be helpful to practice at home. So if you know that your child struggles with advocating for themselves or just building up that independence and going up, even non-verbally by handing over, a piece of paper, is practicing that, let's say with a sibling, or practicing it with one of you. And so they can start to navigate what that problem solving aspect looks like for them.
And I think in meeting them where they're at, I think about a child like, for example, you have a dentist appointment at 3 o'clock and school lets out at 3:30. So they have to figure out a way to let their teacher know I have to leave early. Do you as a parent contact the school, or is it possible your child hands in a note or writes an email if they're a little older? And sometimes you have to break that into steps. So, what we want to do is ask ourselves as parents, do I jump in and make these decisions and kind of do all that advocacy for them? Do I ever let them struggle at all? Because in order for them to learn these skills, we have to be okay that it's going to be a little uncomfortable at times. And it may be hard. So, we're not abandoning them. We're saying, hey, let's do this together. So, for example, I had a child that needed to let their teacher know things. And this was like an older elementary, almost middle schooler at this point, and they weren't able to do it. So we had to start with how can they do it? Well, one, they did it where they had mom's email, they wrote it in so it was them, and then they sent it. The next time it was their email, and then they sent it. So we had to start that way because that allowed them to do it. But think about it, even like initiating non-verbally in that way, that's a skill. So here's that same parent contacting the Smart Center going, I need my child to talk. But meanwhile, self-advocacy is really low. So, being able to stand up for themselves, being able to get a need met. So asking them, how would you solve that puzzle? How would you figure that out? Like they want to cook cookies. They want to bake cookies for a family function. Are you going to give them the recipe or just make it and hand me this, hand me that? Or are you going to say, hey, let's search out some chocolate chip cookie recipes and let me know what ingredients we need. Then we can use that as an exposure. They're motivated to go to a store. And whether they're initiating, hi, do you have, where is the brown sugar? Or where are the this or that? Maybe they need to finish the sentence. Maybe the mom needs to start and say, excuse me, miss, can you help us? Bobby, are we looking for this or that? And the child's goal is turn to the parent, tell them, and then they're on the bridge. Maybe they need to show the note. We have to meet them where they're at, but still challenge them. It's not a hand over takeover till you're blue in the face. It's hand over takeover is a way to stimulate social engagement, which is the fuel to everything. I know I went off on a tangent, but what I'm trying to let our listeners know is it all works together. It's not as if
Exactly.
you're doing these things isolated. That's why the whole person approach is so friggin' critical, because it's
Yeah.
about understanding that child, what they can do and the challenges they have and why do they have those challenges and how can we
Mhm.
support parents to allow for this progress to occur. So
Exactly. And for some of our kids too, like again, always be thinking about maybe what are some of the whys for my child. Like for some of our kids that might have some more trouble with either speech and language challenges or they might have like processing challenges, it could even be you writing different choices on like a whiteboard and then they think through it and then they then allow themselves to go up to their teacher and they show that too. So it could actually be broken down into so many different pieces. So it's really individualized. We're just giving you some general tips.
I mean, we see so many kids with Ys, with comorbidities, with coexisting challenges. We see so many kids with neurodivergence, ADHD, autism spectrum disorder. We see kids with speech and language challenges. We see so many challenges that these kids have that are impacting their social communication. So if the goal is talking and you're missing the boat, you're only going to cause avoidance and more anxiety. End of story. And so the key is those whys have to be known or ruled out and know what we're dealing with. Because if you have a child on the autism spectrum, and I feel we need to bring this up because we see more and more kids on the autism spectrum, and sometimes on the surface they can look somewhat similar, especially with an anxious child. You need to be able to understand that that social puzzle is so challenging for kids on the spectrum. Their sensory challenges are overwhelming. And kids in general that may not be on the spectrum may have a lot of sensory challenges. We see like 80% of kids with SM have these challenges of the sensory in many ways. So if you're asking them or giving suggestions to do certain things in these loud, large, lots of people environments, that may be a reason they're not doing it because the whys are impacting them. So that is why for us, like for me, I don't know how to successfully treat a child without ruling in or out certain challenges because I know that those can impact. And if we're still trying to get them to do things and things are challenging, why are they so challenging?
Exactly. Yep. I agree. So the fourth one is cultivating time management. And I think that one is really important. A lot of these are building on each other. So some of these things we've already talked about a little bit, but really the importance here that I would say is establishing routines. So creating a structured daily schedule that includes maybe designated time for homework, chores, play, relaxation. So if you notice, I'm still putting in fun activities. We don't want to just have a daily schedule of their to-dos that aren't fun. But what if we also add in some of their play or their 15 minutes of you reading them a story at night? So we want to be thinking about and being mindful of what does your daily schedule look like? So I know we already talked about this, but maybe writing down a list of what types of extracurriculars is my child a part of? What types of opportunities do they do? Maybe now that it's becoming summertime, maybe they do swim club every Friday afternoon. So what does that look like? And if you know it always takes your child a few extra minutes because either their anxiety or they also, again, might have some executive functioning challenges, then plotting that into your daily schedule and giving them an extra 5 to 10 minutes to just prepare to kind of clean up their area before they move on actually goes really far. So we find that a lot of times like visual aids and schedules are really helpful for that because they get to see it. And then also, again, you maybe providing that choice, like we mentioned earlier, where you're saying we only have 5 minutes before we have to head out. Do you want to, do you want to play with the Legos or do you want to play with your tablet, and maybe they choose the tablet. Great. And then, they start to clean that up and then they move on to the next piece too. So you're helping them each step of the way, but we have to be mindful of allowing them to understand what does time management look like. And you have to be the ones to kind of start that process for them because a lot of our kids struggle not because they can't do it. Some of our kids do have some of those challenges, but a lot of times it's because they might not know what those next steps look like. And so breaking it up
They're
is
the passenger
really
in the car, Jen. Dr.
exactly.
Jenna, they're the passenger in the car. And we
Exactly.
have to be really like, our goal is to help them become the driver within reason, right? Not
Exactly.
literally the driver, but the driver so that they're making the choices, helping make, decisions, they're managing their schedule. Little kids can have a schedule of what they're doing in the day. They can have a chore
Exactly.
chart, and that builds confidence, and that builds pride, and that fuels all of this.
Mhm.
And it also helps parents because they realize that because it doesn't feel good, as you get older and you're a child that your mommy or daddy or your sibling or everyone's doing for you, it makes you kind of think, well, wait, is it possible they don't think I can do this? And
Mhm.
that affects their self-confidence. So you can see how this all just works, together. And I think with that time management, with the visual aids and the things that you were, talking about, I would say to our listeners, because I'm giving them an assignment for each question, is develop these routine charts to help your child feel in control. It could be daily schedules and chore charts. It could be weekly, monthly, so that they understand what, when, and where. And you ask them, hey, what do we have next? On Saturday, do we have time to do this or that? And they go look at their schedule. Because let's face it, life is busy. And before you know it, they're going to have their own device with their own calendar. And when you feel lost and it's like being on a road and you don't know where you're going. It doesn't foster confidence. It fosters some insecurity and you're very dependent on someone else. Well, where are we going? I mean, we just took a road trip, right? If I didn't have my Apple Maps on, how would I have known? I would have been really anxious about figuring out where to go. And how do I figure out I'm not going to go? So it's the same thing. A time management means, even as a young child, can be their way of navigating their day and helping them figure out, do I have time to do my Legos now? Because in 15 minutes, I've got to get ready to go to the dentist. And so maybe that's not a wise choice. Maybe I should just color instead of dealing with the Legos all over the floor. So they begin to see, and again, that fuels, their confidence and independence, which fuels their growth. So let's talk about promoting. What's the next one we wanted to talk about? Nurturing independence and learning. Want to go into some detail with that?
Yeah, so I think that like the big key here is really supporting your child's curiosity. I think so many times we focus so much on what our kids can't do, and instead using what they like, using their interests, using things that they enjoy and that they're good at, and
Big
allowing that
trouble.
to be big shot role, and allowing that to be areas where we actually allow them to build even more independence. So especially with things that your child is really good at, for example, let's say your child is really good at math, right? And maybe allowing them to explore that, reading about different opportunities for math clubs or researching different things about math, having more hands on activities where you're allowing them to explore that rather than you cutting in, having them kind of, again, be the driver in that car. And really, let's say, a child really wants to, is really interested in birds and wants to learn more about birds, right? Like offering them access to like age appropriate books about birds or educational websites, giving them more of that autonomy, learning, giving them learning materials too. Like maybe they want to make a birdhouse, and they, you want to help them facilitate ways to kind of build up more of that independent learning. So again, it's not that you're just handing it off and you're walking away, but it could be that the first step is you're doing it alongside with them. Then maybe the next time you take a step back while they're taking more of that lead. Maybe they're having a friend come over and they're both learning together, or they could be that big shot and they could teach their friend something that they really like. So, really offering them opportunities for that independence and learning, because again, many times our kids don't always have those opportunities, and it's so important because that's where the self-confidence comes in. And once they have the self-confidence, they're more likely to continue going into situations like that.
So I think one of the things is asking the listeners, what's something you'd love to learn or try all by yourself this week for yourself? Like think about it. But think about it now from your child's perspective to help ask them, what would you like to learn this week? And maybe both of you are learning something, but it becomes a focus during a get together, a small group activity. Having that special interest in learning is all about building their independence in that area, because now they're almost like the bird expert or the butterfly expert, or I know how to do Legos great and I can build castles, or I'm great at that particular video game, or I'm really strong at reading. And teachers nurturing these strengths, right? Like, for example, if they're great at puzzles, hey, Robbie, would you go help Rebecca with that puzzle? It's all about fostering that confidence and independence and realizing they can do it. They're more likely to communicate when they are confident in what they're doing, and that because the anxiety goes down. So all of these things, connection, confidence, it's all about progression of communication, but it starts also with becoming a more confident, independent human. So it's
Yeah.
all about that whole pathway and realizing what roles parents have in stepping back, and now they may become a little bit of the passenger in the car and giving them that role of being the driver in the car. And then all of a sudden, confidence is up and you see them sit up higher, more willing to do something. They're willing to take more risks. They're not as much of a perfectionist because they're okay to make a mistake here and there. It always ends up kind of being this whole process all together. What other thoughts do you have to kind of sum up the importance of building independence? Because we do this
Yeah.
with families. We create worksheets, we give
Yeah.
them homework assignments, along with the social communication and social communication exposures. It's all
Yeah.
intertwined.
Yeah. I would say that, like, I think overall, as we talked about these five key strategies and key aspects to really helping your child, is just consistently working on, all of these things and really empowering your elementary school kids, because I think that that's where, again, where they're going to develop more of that confidence. They're going to develop the skills that maybe they didn't necessarily have the option to do before. And honestly, it's going to also allow them to understand that, people believe in them. I think a lot of times we're so focused on what our kids maybe aren't doing, but it really allows you to celebrate their progress, celebrate their wins, giving them those opportunities and showing them, like, I know you can do this. I'm here to help you along the way, but here are some skills that I think would really help you, and like Dr. E mentioned, maybe thinking about how that relates to all of you and what do you feel like would be the most useful for you to learn? And our kids are the same way. So I think that's a really important key, but definitely taking it one step at a time.
And meeting them where they're at. And that is the beauty of the social communication bridge. When we're planning goals or games they're doing to play and they're realizing they're moving across, or that was loud and large. Like, why don't we bridge down here? And
Mm-hmm.
the child's like, no, I can do that. They're more willing to take risks when they don't feel your pressure for them to speak, speak, speak. You got to speak
Mm-hmm.
because communication will come, especially as you're bringing them into these opportunities and you're building all these other skills. And hands in your pocket, band-aid over the mouth for parents. I make that joke, and sometimes I have to give some parents like that jump in parent that jumps in and answers or jumps in and tells their child what to do, and the child doesn't have that opportunity. I have to give them that goal of hands in your pocket, band-aid over your mouth, within reason, meaning of course they're helping and they're using their hands or they're using their mouth to give them a choice or to make a suggestion or to explain, hey, I know that's harder. What do you think that was on your feeling scale? But you're meeting them where they're at and you're supporting, and it's a team approach. It's not you need to do that, you should do that. It's let's work together on this. And it's not like you're telling your child you have to work on your independence. These are just skills to do in your everyday life that builds independence. Because by saying you have to be less dependent on me, what does that mean? I've had families say that in session, like, you can't be so dependent on me. It's like, that doesn't mean much. That scares a child. So rather than tell them that, let's do things within our everyday life to support that growth with their involvement in a really proactive way. So we're going to, in the show notes, we're going to have a handout that, basically summarizes what we talked about. And we're going to do an episode for encouraging independence in teens and young adults. So, but we wanted to focus on one age range with the examples we gave and so forth, because that's not necessarily appropriate. What I say all the time is concepts are the same, but it changes based on an individual's age. So thank you, Dr. Jenna. This was great. And I'm very excited about all of our episodes and all the many ones we'll have moving forward. And again, we didn't even talk about selective mutism so much in this episode, but a very critical skill of becoming a more confident, independent social communicator, right?
Mm-hmm. Thank you.
Thank you. Thank you for listening to Unspoken Words, a Selective Mutism podcast hosted by me, Dr. E, and the Smart Center. This episode and all episodes of Unspoken Words is produced by New Edition Productions. Don't forget to submit any questions you have from today's episode using our Ask Dr. E form on our website. Just head to selectivemutismcenter.org/ask-DRE. I'd love to answer your question in a future episode or blog post. Remember, for the best of this episode and every episode of Unspoken Words, please follow the podcast on Instagram and YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words by DRE on YouTube. Or join our newsletter for additional SM content. We release new episodes every other Monday at 6 a.m. Eastern Standard Time. We'll see you next time.